can old facial scars be revised or improved? Yeah, interesting word old there, because like old implies that that's a bad thing. That's an old facial scar. But actually, we would only try and do revisions of scars on old scars. So if it's a new scar, we would tend not to do any sort of scar revision. So you kind of, usually it's about a year. You have to wait at least a year because you want the scar to mature. You want the scar to get as good as it's going to get before you consider revising it. So yeah, the old word is not actually a bad thing there. We would only consider revising old scars, be it facial or wherever they are, because if they're going to get better over time, there's no need to sort of intervene. So yeah, so that's got the old word sorted. Can they be revised or improved? Well, it depends. Sorry to be evasive, but it does depend. It depends on what the problem is. So it has to be kind of like a specific problem for us to be able to revise or improve it. If it's just the fact that you've got a scar and you don't want a scar, then that's going to be tricky because you're going to always have a scar. And certainly if we do anything as surgeons, we're just going to give you another scar. And our scar is probably going to be bigger than the original scar. So we're not even going to give you a smaller one. You can't kind of really shrink scars. But there are things you can to improve scars in certain situations. So if the scar's stretched, for instance, we might be able to excise it and stitch it and hope that it doesn't stretch again. There's no guarantee that it won't stretch again, but it's always a possibility that it could stretch again. If it's stretched, we might be able to revise it and make it less stretched. If it's lumpy, we might be able to do something, some injections or some silicone gel or tape, or for bad lumpy ones like keloid scars, you can sometimes excise them, although you've got to be careful with that. And if it's in a bad line, saw a patient the other day who had a scar coming down their face, their forehead like that, and that's a bad orientation. You normally want them like that, and this here you might want to go up and down, but there you want to go like that. So it would have been possible to revise that and make it a zigzag shape to make some of the scar lie in the lines and break up the scar a bit, but obviously that's quite a lot to take on because that scar will be bigger. So you'll be revising the scar and giving a bigger scar, but hope the orientation of the bigger scar is better than the old scar, but that's quite a lot to take on. And so it's not all it's cracked up to be, I'll be honest with you. So it's you've got to be kind of realistic about what you can do in terms of scar revisions, and sometimes, or at least we're not always able to help, and in fact we're often not able to help. There are obviously non-surgical things you can do for scars, things like they do the little rolling things and all sorts. We don't really get into that. We've got a question. But in terms of surgical revision for scar, you've got to be careful. So you can revise scars, and you can certainly revise old scars, but you have to be very clear about what your outcome you're wanting to achieve and what we can do with the surgical scar revision as to whether it's worth you taking on what we've got